Now, as plastic surgeons, whenever do any procedure like a skin graft, or we do a flap for the upper extremity or lower extremity, and even for skin grafting, as a rule, most plastic surgeons and most plastic surgery units advise pressure garments routinely. Now let us see, why do we advise pressure garments after all these procedures. Now pressure garments tend to apply constant and gentle pressure to the donor site, which helps to flatten and soften the developing scar. So this pressure reduces the risk of hypertrophic scarring. That is the reason why we need to advise it to all patients for their donor sites. Now the pressure from these garments help regulation of collagen, and by controlling collagen synthesis, obviously there is more flatter and more cosmetically acceptable scar. So even if customized pressure garments are not available, not accessible, not affordable, we can always advise a crepe bandage application. Now whenever we do a flap for a lower limb or for a upper limb and there is some cavity underneath the flap, pressure garments help to compress the area and avoid seroma formation, avoid some collection of fluid beneath it. It also helps in adherence, early adherence of the flap, and it prevents side to side shearing of the flap. That is why we need to advise it in cases of flaps as well. Now lower limbs, upper limbs after trauma tend to have a lot of edema. This edema, even though we advise limb elevation, there is some amount of edema which always remains. Now pressure garments in the form of crepe bandage in the early post-operative period, by early I mean maybe day 4 or 5 whenever the flap has settled in pedicle flaps. So these pressure garments help to compress the area, reducing the edema and increasing the aesthetic outcomes. Now if we have done propeller flaps or islanded flaps, the pin cushioning effect is definitely there. Now pressure garments tend to nullify this pin cushioning effect to a great extent, and there is no pin cushion scar which is seen after 6 to 9 months of regular use of pressure garments. Now one issue of donor site itching is also addressed by pressure garment, by wearing pressure garments or by application of crepe bandage. So there is, I am not aware of the scientific reasoning behind it, but yes, donor site itching also is controlled by pressure garments. So that is the reason why we should advise pressure garments after all these procedures to all our patients.